Welcome to Second Opinion. I'm so excited to show you today how the AI predictions and detections are going to help you in your operatory. Bringing Second Opinion into your daily workflow and using it chairside is like having a second set of eyes or an additional layer of support for you and your team. We're also going to be reviewing the excellent case presentation tools. You can now use the Second Opinion platform chairside to show your patient their different conditions and pathologies in color, helping them understand their condition and helping them trust that they should move forward with it, ultimately improving your practice production. You'll log in by going to secondopinion.hellopearl.com, using your team's credentials, logging into the homepage. Now, on the homepage, you'll find that you will always see 90 days worth of patient files. However, we also synced back 12 months in historic images and pulled them into the platform as well. In the top left corner will be the most recent radiographs taken. We can see the patient's name, their date of birth, and how many images were in that series. Now, because we do want you using Second Opinion in your operatory in each appointment, we know that having this homepage with all the patient names showing may be an issue. Not a worry. We also added a PHI button located in the top right corner. When you toggle the PHI button off, it'll hide the names of all of the patients on the homepage. Now reviewing, we can see that only the first and last initial is showing, unless we hover the cursor over it, and then we can take a sneak peek to confirm that the patient in the radiograph is the patient in the chair. Now, because we also synced 12 months of your historic images, you can go to your search bar and search for any specific patient you'd like to look up if they weren't x-rayed recently. Typing in the first name, last name, and clicking into the image will bring you into the full mouth series. Now from here, there is a little bit of functionality to go over. Your images should come mounted in the correct spot for the tooth numbers. However, if you notice that they didn't or you want to move them to a new spot, it's very simple. You'll click the image, drag it, and drop it to the new spot where you want it. This will open up a range of teeth. Please feel free to select and slide the image to the appropriate tooth numbers and hit accept. This will move your image to the new mounted spot. Across the top, you'll see dates. The most recent will show up here, and any historic images will move towards the right. Now for our AI findings. You can see on the bottom left corner that we have pink, purple, and green dots, and occasionally there will be blue as well. This is letting you know that the AI has found a type of pathology or condition for your patient. Clicking in the image will open it to full screen. And from here, if you need to review the next image, we have arrows to the left and right of the image that'll advance you through your series. The other option is to take your cursor to the FMX icon located in the top, and you'll see a pop-down. Once this pop-down is here, you can select any image you'd like to review next. Now let's talk about those AI detections. For our hygiene team, we are giving you bone heights or bone measurements. We're measuring from bone crest to CEJ, looking for that clinical attachment loss. We'll give you 3 separate severity levels. White is between 0 and 2.5 millimeters of bone loss. And if it's yellow, it's 2.5 to 4 millimeters of bone loss. And not pictured here on my example is an orange or a bright amber colored line. This would be 4 millimeters or greater of bone loss. Now, just like everything with radiology, the angulation at which you took that x-ray is important here with the bone heights. If there's a little elongating or shortening, that may adjust those lines a little. Just be aware of that. For hygiene, we will also notate any areas of calculus with the green square. You can see when I hover my cursor over this square, it's also going to give a little pop down there letting us know that we anticipate that this is a calculus prediction. Or this one here. Also, bringing your attention to the right side of the screen, we have a guide letting you know the different pathologies, the color for them, and how many of those findings we found on your image. The purple squares will notate notable margins or overhangs, just bringing your attention to that area that may be a problem for your patient. And for our caries, these will be 2 shades of pink. If the shade is a darker magenta color, that's indicating that the caries has entered into the dentin. We can see here when I cover my cursor over the caries area, it gives us an outline and allows us to see through into that radiolucency. We also have a breakdown above in that square. This is letting us know that the caries is made up of 4% enamel and 96% dentin. Or up here for this example, it's made up of 69% enamel, 31% dentin. Now we also wanted to be able to give you the visibility into those early detections as well. We'll highlight any of the incipient caries or the 100% enamel areas in a light pink, giving you the ability to show this to the patient, helping them have the visual aid to understand that these are not necessarily cavities that you'll drill and fill into, but let's open the conversation of preventative measures. Should we talk about fluoride with these? They're excellent for the patient to understand. Now we give you a full toolbar located on the right side of the screen as well. There's a full screen mode, or if you happen to move your image around on the screen to review a spot maybe a little bit closer or better, you can also reset the view with the second icon down. We're giving you a ruler, great for using to measure working length for endo or implants. And we give you an edit tool. It's important to remember that the AI is using computer vision to apply our predictions, but ultimately, we are not diagnosing as a second opinion artificial platform. We still want you to have control over your images, and we want you to make the decision for your patient. When using second opinion artificial intelligence, you may find areas that are a false positive or a false negative, and if you disagree with the detections, you have the ability to edit those. Turning on the edit feature, you can take your cursor to any of the detections on the image and select the X to remove them. This will remove any false positive for you. You can add them back by using the edit tool as well and selecting the green check. On the flip side, if you're reviewing an image and you feel that the artificial intelligence did not detect a condition, you can also use the edit tool to draw a square around the area. Having the square will give you the ability to select the condition appropriate. There's a full list of different pathologies down below, calculus and caries, or periapical radiolucencies. And selecting the appropriate condition for what you're reviewing will also change the square to the correct color-coded color. So if I select caries, it will change my square to a pink shade. Now again, it is important to remember you are making the decision for your patients. The artificial intelligence is just wanting to bring your eye to the area of interest. You can disable or enable the measurements using the measurement button. Now let's talk case presentation. Of course, it's helpful to have these squares and different colors on the image, just as you can see here, to show the patient where their different pathologies are. But you have a couple different options here. You can hold down the space bar to review your image back to its original format. We can see all the different shades of gray, and you can use your expertise in reviewing the image this way. Ultimately, though, the spacebar is a great way for you to show the patient that you have the ability to use your expertise and knowledge to review their x-ray, but you can show them the image and remove your hand from the spacebar to pop up the area of the pathology in color, helping them understand when you explained that there's a cavity here in the grayscale. However, let's help them see it in color, showing them the AI findings. That spacebar is very handy and easy to use. However, we also have the ability to toggle the AI viewers off in the top right corner as well. Now, along the same lines as case presentation, of course, you can use the spacebar to enable or disable those AI findings. But as we're discussing with the patient the cavity, If we want to help them understand the different structure of the teeth, we can use our tooth parts button. Changing the teeth into color. We can now see the enamel is purple and the dentin is green, and helping the patient see that we've gone through that enamel into the dentin area here. We like to call this tool the aha moment. It really helps give a great visual aid to the patient in helping them see the severity or the need for their continued treatment plan and follow-ups. Down below, we have all image editing tools. You can increase or decrease the brightness, the contrast, or zoom in and out using a slider. You should note too that you can also zoom in and out using a roller on your mouse and reset if needed. We have an invert and an enhancement tool. Now the enhancement tool is going to increase or decrease the clarity of your image. The lower the image clarity, the softer the image will appear. The higher the clarity, the more crisp and defined the clarity will appear. For the most part, we hope that your images look just like they do in your imaging software, but what we recommend is to go through several patients after you review training today and determine if you need an enhancement level. Once you set the enhancement level on a device, it will stay there for all images moving forward. So if you decide you need your enhancement level on number 6, go through each computer in your office, set the enhancement level, and then we like to say, set it and forget it. The reason for that is if someone comes through, changes the enhancement level on one computer, changing the image view from the other computers, it can get a little confusing. We also have a rotate here or a flip if needed. Now on the right side, I mentioned our guide. These are all of the pathologies and non-pathologies that we are FDA cleared on. You'll see calculus is green, caries are shades of pink, notable margins are purple, and we are also cleared on periapical radiolucencies. This will show up as a blue square around the abscess area. Now, these are great for toggling on and off the different conditions on your image. So as an example, for your front office team, we want you to know that you can also use these x-rays and the AI findings for your role as well. I've toggled off my notable margins and my caries, and I want to submit Irvin here to my insurance company as an SRP or a scaling patient. I can use this image with the AI findings I've left enabled and go to the printout in the top right corner. Once I hover my cursor over the printout button, I have 4 different options. I can use a patient printout just grayscale, evidence for claim, one image, or all images. To give you an idea of what that will look like, selecting evidence for claim, one image brings my x-ray that I'm currently reviewing into a PDF. The PDF will have the patient's name, the date of the appointment, and those AI findings. So we can see the bone height and calculus here. We also left the area down below. You can use this for adding any notes. Once you've downloaded the PDF, you can use a PDF editor. Submitting this to your insurance can be very helpful. We're seeing a much higher approval rate and a lower denial rate when using the AI findings. The other benefit here to this particular single image with the AI findings is if you have a patient that you need to send home with some directions for home care. Go ahead and pull up their image, print this out, and then you can write down the directions for their home care. You can put it down below, giving them the ability to take that home, because we all know once they get home, they seem to forget. The other option in our printout is going to be the patient printout. This is an excellent tool if you've had the patient in the chair and done the hard work to diagnose and treatment plan, but they want to leave without scheduling their follow-up. Generating these PDFs gives you the ability to give the patient several different pages with their x-rays to remind them of why they need to call you back to schedule their follow-up. They can take this home, seeing the different areas of caries or calculus. And we also changed the terminology to be more patient-friendly. Cavity instead of caries and tartar instead of calculus. Again, this is going to be an excellent tool for multiple scenarios to send it home with the patient. Coming back to the second opinion platform, I do want you to know that your bone heights here are customizable. I went through the several different severity levels, but if you go to the settings in the right top corner and select Customize Interface, this will give you the ability to open your bone heights. If you are an office that does not want the bone heights enabled, you can toggle them off completely. Or you can just toggle off the white lines, leaving the yellow and orange more moderate or severe. And if you would like to edit the heights and change those defaults that we have set, you can do that here as well using these arrows. Just remember to hit save and you're good. Quick call out on the contact information here in the second section. If you'll fill this out for your practice, this will be added to the bottom of your PDF that you'll send home with the patient. And the last section we'll be reviewing today is going to be this question mark in the top right corner next to the settings. The question mark will lead you to our Help Center. Now, of course, we hope that you never need any type of troubleshooting or additional help, and it's a smooth ride for you. However, if you do find that you need support, coming to the Request Support option here in our Help Center will open up a page. From this page, you can select the appropriate form to fill out, and filling this out will submit a ticket to our support team. Submitting this over, we do ask that you'll give us a summary and as much detail about the trouble you're experiencing. For example, if your images have stopped syncing, please let us know what happened if you happen to make any network changes or any changes to your server. This may be helpful for us. Adding your organization or your office, and then of course, if it's necessary, you can also download some of the attachments for us, sending us over screenshots. This will come to our support team and we'll get back to you as soon as possible. And this is your second opinion platform. Again, working this into your workflow, we would love to see assistants and hygienists pulling up the platform, using reviews for hygiene, and ultimately leaving it up for our doctors, giving them the ability to quickly and easily see those areas of interest. And then doctors, we'd love to see you using the platform as a case presentation tool, helping your patient, educating them about their conditions, ultimately helping them accept their case. We're happy to have you a part of the Second Opinion platform team, and if we can help you with anything, please feel free to reach out at any time.